and welcome everyone to our second day national webinar on suicide prevention during COVID-19. I am Bulina Demari, psychiatric social worker from the Department of Psychiatric Social Work, LGBRIMH, and I am pleased to be a coordinator for this evening. Before I start the program, to all the participants to let you know that the webinar is broadcasted and telecasted through Facebook, YouTube channels, and through our Google Meet. A recorded version will also be available in our YouTube channel. We will also, and I'm sure during the panel discussions, our audiences will surely have questions and queries, comments, and we request them to place any queries, comments in our chat box, which is available in your YouTube channel, Facebook, and the Google Meet. And these questions will be discussed after the panel discussions, and we'll give a slotted time for each. And we would also like to put your name and your place from where you're coming from, so that we can. It will help us to identify you. And I think we have almost nearly 200 participants in our audience, and it's a quite phenomenal talents and intellectuals are present in our audiences today, along with a few of the speakers of our previous day. And we are lucky to have you all here, and we are very happy to see you today. We know we will have comments, views from our audience, which will definitely make our panel discussions more valuable today. And now I would like to request Professor Sonia Deori, HOD, Department of Psychiatric Social Work, LGBRIMH, to say a few words on this day of suicide prevention.
Good afternoon, good evening. We must say good afternoon, good evening, because we're always almost into evening. So it's a good afternoon, good evening to everybody who's gathered here. We are about 210 people attending this as of now. Of course, the number is fluctuating. People are coming in collaborative research going across the country, and we are also part of that initiative, and we are coordinating the northeast part of the research that is happening, which is the PI is the main PI is actually Anish Cherian, and we have his other colleagues also. That is his PhD scholars are there. That is Bharat and Lashmi. Both of them are also part of his group who are coordinating the various activities related to suicide prevention. And we also have a faculty from St. John's Psychiatric Department, Dr. Priya Sridharan. And she would be, I am not very aware about her, but I'm sure that our organizers are aware about her background. But she would be adding to the area, because we have people from social work, and we definitely need somebody from the psychiatry to give us a various perspective. So I would like to request the panel members to start off the discussion. We'll first have a brief presentation, what they would like to talk of the presentation, and then maybe we could invite members to discuss various issues that are there and what is the way forward. I think is the basic plan is how do we go, but how do we sort of carry forward this agenda of prevention? How do we as social workers and other health professionals, how we can take forward this area of suicide prevention in the most effective way, rather than just being, let's get into practical areas, how we can go about doing things, how we can initiate online services. Now, since the whole modicum of work has gone the online way, I think, so all our activities, of course, there is a limitation to all these things, but definitely we can go forward and make it a little more acceptable and available to the common man. That is what is the most important aspect. With these few words, I welcome everybody and I request organizers, the organizing team, to carry forward the agenda for the next panel discussion. Thank you.
Thank you, ma'am. Today we have a for our panel discussion. Very important of the hour. Suicide prevention, which is our topic of panel discussions, the way forward from the current pandemic times. We all know COVID-19 pandemic has been historic and challenging for the entire world. It has plunged the world into uncertainty, leaving every individual with fear, anxiety, depressions, and other mental health issues, with suicide being the major health concerns and with its increasing death toll at present time. Our objectives with our time today is to share some of the thinking about how to minimize the risk of suicide, what strategies can we take to address this, and what is needed to do to prepare ourselves for this pandemic. I'm sure there will be a wonderful discussion from our 4 panelists today, along with our audience, we have our audience full of intellectuals, academics, and I'm sure it will make the discussion very vibrant and fascinating. And now I would like to introduce our speaker, Dr. Anish Cherian. He is the Associate Professor in the Department of Psychiatric Social Work, NIMHANS, and Bangalore. And he is an outstanding researcher, as well as he has done many projects, national as well as international, and he has received many fellowships from different organizations. And he's one of the member of the Indian International Association of Prevention of Suicide. Welcome you, Dr. Anish, today. And we have in our panelist, Dr. Priya Sridharan. Dr. Priya is an associate professor in the Department of Psychiatric, and she has been in charge of an assertive management of attempted suicide, AMAS, which is an outreach service, and Madam will be discussing on the assessment of suicide. Then we have our PhD scholars, Mr. Bharat, who is also in the panel, one of our panelists. He's a PhD scholar in the Department of Psychiatric Social Work, NIMHANS, Bangalore. And he has worked as a guest faculty in Madras Christian College and Pondicherry University. His interest area is in suicide, prevention, de-addiction, and networking with community-based organizations. And we have the 4th panelist, Ms. Lakshmi Vimala. She's also a PhD scholar in the Department of Psychiatric Social Work, Bangalore. And her interest is in suicide preventions and media reporting, on which I think she'll be delivering it today to us. And she's also involved in gatekeeper training program in NIMHANS. And today our speakers will try to explicate and give us the perspectives and opinion on the topic with their share of experiences and expertise. So with that, I ask all our audience to give their full attention to our panelist discussion. And with this few words, I would like to hand over to Dr. Cherian, our speaker for today's panel discussion. Yes, Dr. Cherian, the screen is yours.
Yeah. Thank you very much, Sibuli. Thanks for the good introduction, and good evening to all of you. It's nice to see all of you, and I initially thought when Arif called, I thought it's a national webinar. I see some of them are from, it's a truly international. I keep seeing a couple of people from international audience as well. So it's really phenomenal to organize such a important topic for the discussion today. Thank you very much. And thanks for the Department of Psychiatric Social Work. I've been very closely working for over the last 5 to 8 years with many of the senior colleagues. Since I'm a student of Dr. Sonia, and I'm very close working relations with Dr. Shobna as well, and all other colleagues, Arif and Buli. It's nice to have you to work and discuss today one of our important topic and the area which we are working for over the last 5 or 6 years. And we have been actually discussing about suicide and suicide prevention, especially in the during the pandemic. Earlier, it was considered as it's a shadow pandemic. Suicide has been considered as a shadow pandemic with the COVID. But now, at the moment, the literature shows there's an indication that there is a slightly increase in the number of suicides, and it's being considered as a parallel or coexisting pandemic. Unless we take a proactive step to address this now, we might lose many more lives in the future. So this is our responsibility as a mental professionals, and especially from the field of psychiatric social work who works in the community, to address this shadow pandemic. So I think it's indeed it's nice to see that Department of Psychiatric Social Work has taken this responsibility and taking one step ahead and getting people to get awareness and getting the training done for various. I think last week we had a talk. The same panel had actually we trained some of the social work students in University of Kashmir. And now we have other group of people from Northeast. It's our privilege, actual privilege, and thanks for this invitation. What we know so far is that from various pandemics, there will be slight increase in the number of suicide during any pandemic. If you look at the Spanish flu, then there was a study conducted in 84 cities. It indicated that there was an increase in suicide then. During SARS, if you notice closely, there is an increase in suicide among elderly, especially in the people in Hong Kong. The early preliminary results from COVID studies indicates that there is a slight increase in number of suicides even during this pandemic. We have conducted one, Lakshmi can actually discuss it more. We have followed 30 newspapers in population Bangalore. We found closely 1,000 odd suicide reports.
We are sorry to interfere in between. If you have any slides to be shared.
We will come into that. We will discuss, and the panel will, we'll be sharing that. Yeah. So the results we have to analyze, but the preliminary results indicates that mostly middle-aged. There is a change in demography. Earlier, it was more of suicide among women, but if you look at now, there is a change in gender, like mostly middle-aged men. And mostly the reasons were quoted as financial reasons, and method was hanging, and less use of pesticides or jumping in front of a train. And there are a lot of results indicates also that there are alcohol-related suicide. And if you look at yesterday's newspaper, there was a suicide happened in Kerala. In the center itself, so that there is a number of suicide is increasing. In that context, we found that we need to address this crisis. And panel discussion, we thought we will address a couple of questions. We thought we discussed among ourselves, and we thought we'll address some of the questions like what are the risk factors associated with COVID suicide during this COVID-19 pandemic, and then what are the interventions are available to address this, and what are the suicide prevention strategies what we can plan for professionals across India. And we also have panelists who will talk about role of media to address and suicide during this pandemic, and whether this media is sensationalizing the news or whether is it supportive. What can be done to address this scenario? I'd like to request Dr. Priya to initiate the first talk on what are the risk factors related to suicide during this pandemic.
Hello, good evening. Thank you, Anish, for that introduction. And thank you for all the organizers for having me in. We've heard a lot of wonderful things about the LGB Regional Institute of Mental Health for Tezpur, and I think they are doing fantastic work in a low-resourced area. So, as Anish pointed out, I'm going to be sharing some of my slides now, not all of them, and I will briefly cover what are the risk factors and what is it exactly we need to evaluate when we are looking really at when we're looking at prevention of suicide. I know the previous day had covered media matters and several other aspects, which we will go over it again. So I will just begin with the presentation. I hope my slides are visible. To want to take psychiatric social workers or psychiatrists or psychologists or non-specialist mental health workers, how can we So certain terms of interest when we look at identifying people who are at risk of dying due to suicide is we talk to them, and by evaluating them and by talking to them, we try to figure out really this level of suicidal ideation or the intentionality. That is, a lot of times I think we're all specialists, a lot of us are specialist mental health professionals here. I see a lot of psychiatric social work students here, but I see a lot of masters in social work students also logging in, counseling students also logging in. I think it goes without saying we have to ask people about suicidal ideation. There's a myth associated that if we ask, we'll be inducing suicidal ideation in them. No, not really. In fact, it's usually a big sense of relief to discuss that. So we ask them, and we don't just ask them have they harbored these ideation, but importantly, how serious were they really about dying, in terms of did they have plans, did they wind up certain things before that, what were the means that they were really looking at to hurt themselves, how lethal were these means, whether it was pesticides, presence of common chemicals. And an important aspect, sometimes it's hard to directly ask about intentionality or lethality, a sense of hopelessness. Really, did they, I mean, they've been going through a tough time. Do they really expect the situation to improve? If this situation is not improving from this, are they looking at trying to take their lives? I think these are key important terms of interest. You know, this is mental health institution area which we are giving the talk right now, and a lot of us will be well versed with a lot of scales. But I think if we know these three terms, we can do a lot of work. We really don't need to be held hostage to scales all the time. So as Anish alluded to, the NCRB report is out, and while the pre-COVID findings are not really related to NCRB, we need to understand that what we have understood as doctors about COVID is that COVID is terrible in people who have pre-existing health issues. People who don't have pre-existing health issues, nothing really happens. You can apply that to also people with pre-existing vulnerabilities from a mental health aspect, pre-existing psychosocial issues, psychosocial stressors, vulnerable populations. They are all at risk from mental health issues and possible suicidal ideation during this COVID pandemic. So, in keeping that in mind, let's look at just briefly the key findings from the recent NCRB report that has been released out. We're looking at an increasing trend of death due to suicide. Maharashtra, Tamil Nadu, West Bengal, MP, and Karnataka are top states, although the other northeastern states don't have such high rates, but we'll have to see how these figures pan out over the next years. And while farmers and students are populations perceived at high risk, and we should intervene in them, daily wage earners, homemakers, self-employed and unemployed, and if you look at it, these are the group which really don't have financial stability. These are the groups that are at high risk of dying due to suicide, and I think it's important we keep that in mind, because we've seen how migrant workers and all have suffered also during COVID. The common modes of attempt are hanging and consumptions of poisons. Now, these poisons are not necessarily pesticides as you would see in vulnerable populations by farmers, but also commonly used household substances. Now, why is it important for us to know modes? If we know modes, it allows us to restrict the means to access, and I will be coming to that later on, where you have family problems, mental illnesses, other psychosocial issues, and substance use. And as Anish pointed out, more men than women, and marriage is not necessarily predictive. So while you will see a representation of widowed, separated, single individuals, marriage is not protective. And that's what the NCRB reports. So we keep these risk factors in our mind, and from this, we evaluate the potential risk factors when an individual comes to us. Yes, identifying the presence of a psychiatric diagnosis is extremely important because it gives us pointers to act. See, when you've identified a psychosis or when you've identified depression, severe depression, it becomes that much easier for us in terms of counseling to give medication. But we know very well in India, depending on really the setting from where it is, a large proportion, a significant proportion don't have a psychiatric diagnosis in India who died due to a suicide. So identify all these potential risk factors, identify the presence or absence of a psychiatric diagnosis. And this is extremely important when we are doing the evaluations, we are setting up services for prevention. We identify really who can accompany and be there with the individual and where the individual can be referred to. I think these are as key aspects as identification of presence or absence of a psychiatric diagnosis in a service, and see if we can refer. So these are important factors. So let's look at the current perspective again. We look at presence or absence of psychiatric diagnosis like depression, anxiety, alcohol, and psychosis. I'll be dealing with it in the next slide. And we look at other causes, important causes, because as we know very well, and as most of you all are in relation to social work, especially in India, it's very unlikely that there's a death due to suicide or a suicidal attempt in the absence of psychosocial stressors like love failure, domestic troubles, and financial. Now, access to means that reduce the attempts. When impulsively a farmer wants to end his life, he doesn't have the access to pesticide, and that delay can paradoxically protect his life. In the UK, Keith Horton and all of them have studied and looked at the fact that reduction of the size of paracetamol, commonly known as due to suicide, right? So access to means is important. Now, again, when you're planning services, local analysis helps. For example, in Bangalore, because we're a tertiary care center, we see a lot of people who are very medically sick when they come with their suicide attempts. So our population has a fairly high prevalence of drug to take it. Of course, when we look at identification of psychiatric diagnosis, we look at A, identifying whether there is a psychiatric diagnosis, B, irrespective of that, motivating to seek help. A psychiatrist will help really if there is a psychiatric diagnosis or not. But if there isn't a psychiatric diagnosis but mental health issues, role of psychiatric social workers, clinical psychologists are extremely important. So motivating them to seek help, letting them know that there's a help, and keeping a ready list of centers for help, letting them know that there are people who can understand their distress and help, because people who are actively contemplating taking their life are often in a very lonely place, which is why they're often contemplating these steps. Let us briefly go over it. Symptoms associated with common psychiatric diagnosis that are associated with suicide. I'm not talking of common mental illnesses per se. So we're looking at, for example, if it's depression, you assess whether there is pervasive low mood all the time, there is anhedonia, there is guilt, anxiety, a sense of fear and apprehension. While we all focus on depression, anxiety is something that a lot of us miss. And anxiety disorders are also overrepresented. But a lot of focus is on depression without missing out the anxiety. So I think we should look at anxiety. Substance use, as Anish pointed out, alcohol use disorders as the primary risk factor, or if the husband is drinking, the wife is looking at taking her life because she's not able to handle it, or drinking alcohol so that you get the courage to take yourself. Alcohol is an extremely important factor to look at, and of course severe psychiatric disorders like psychosis. So when we are planning services, we need to keep certain aspects in mind. We need to have strategies by which, when we are evaluating, we identify hopelessness, the degree of ideation, the degree of lethality, and previous attempts. We need to identify who is there with them, who can be there with them, where they can be sent. And we need to figure out broadly these stages, irrespective of the resources that we have, that we have to make sure that the individual has the permission to talk. We have to make sure that when we are with the individual, we're as empathetic, we're not judgmental. In the initial stages, it can be extremely anxiety provoking for whosoever is it, whether it's a psychiatric social worker or a social worker sitting with them, whether you're manning the crisis line or it's the initial assessment. When someone describes about suicidal ideation, there's a part of you that may think, no, you're going against your religion, or come on, other people have come up. It's very important you realize that they're in distress. And while their distress, the reasons for their distress may not make sense, they are in distress. So you have to be empathetic and non-judgmental. Important that you don't demonstrate your anxiety over them. That's what I say when I mean don't be emotional. And importantly, motivate to seek help by referring to mental health professionals, wherein if there is a psychiatric disorder, psychiatrists will come in, therapy, medications. When we're looking at active suicidal risk, inpatient treatment would probably be the best, with regular follow-up with psychiatric medication. Subsequent management, and this is very important, especially the role of psychiatric social workers and social workers to set up services wherein they can be checked on constantly even after the discharge, assessed for repeated suicidal thought, motivated to seek help, and motivated to avoid substances. If you look at follow-up studies, brief contact interventions like postcards, letters, SMSs, phone calls, emails, all of them can help. There has been enough literature to show that has worked, including in the Supremist, which included Chennai as a study. And you can train non-specialist workers to at least do this kind of inquiry. In fact, we've had. May I continue? In fact, we've had a clinical service which has been a nurse-led service, and she's not a specialist mental health nurse service, who has done an excellent job of following up people on phone, wherein we've been able to follow up almost 90% of the population until she has followed up around 1,000 people. And through her experience, we've been able to go ahead with assessing feasibility of contact interventions using telephone, using non-specialist mental health workers. So to reiterate, I think we can set up services, but as part of these services, as part of suicide prevention, we need to assess, identify risk factors. We need to make sure that there are mechanisms for referral. We need to work on making sure that when we are part of these services, we show care and give hope, because there is always a way out. And from here, I think I will hand it over to Anish so that he can further move on.
Thanks, Priya. To have little more insight on what are interventions available, or what we can do. Can I ask Bharat? He's also a PhD scholar in our department. He's working. He's developing suicide prevention training module for social workers. Shall I request Bharat to talk about more on that?
Yes, sir. Thanks for the introduction, sir. I'd like to share my screen.
Yes.
So, as Madam has mentioned, the importance of assessment and assessing the risk factor is very important. And since I started my PhD work on developing a module for social workers, so when I've undergone the literature search, what are the interventions that can be planned in a community, not as just a social worker, as a mental health professional or a professional who deal with a lot of people who are come with a distress. So this presentation, I like to touch upon what are the levels of prevention approaches that we can plan in the community, in the institute, and the individual level. I'll more stress on the individual level intervention, what are the things that we can plan. So I'd like to move. So first we can start about the universal prevention activities. As Madam pointed out, increasing the awareness, increasing the knowledge in the general public will always help in addressing the stigma as well as increasing the help-seeking behavior. So we used to conduct a lot of awareness programs in the college, schools, and general public on suicide prevention activities. So most of the times, when after finishing our session, definitely we'll spend some half an hour with the population. The clients definitely they will ask, we like to talk to you, we wanted to know more about this. So there are some concerns they have, but they doesn't know where to get it, to get the information and how to go about it. So this increased awareness strategy, definitely it helps in large level of people to identify where the services available and whom to approach. So increased awareness programs, if we are planned in school, college or community, as a general strategy, definitely it helps in understanding suicide can be prevented. And there are a lot of health promotional approaches that we tend to work with a lot of IT workers or a college students or a school student or a general public. So during that time, we can actually include the suicide prevention component as well. So considering suicide as a coping mechanism or a negative coping mechanism, we always include this component in a stress management program or a life skills training program, so that people will understand that if there is something happens, there is some negative events happen, when we get some negative thoughts, definitely we can rely on someone who has given some source. As well as the media campaign, especially this media campaign, I hope everybody is aware about the celebrity suicide 3 months before. So I have seen a lot of my friends who are professional and not professional people are kept status about the celebrity, and everybody pointed out that since he is status. So during that status, we can keep it. If somebody has some distress, you can contact this number. There is suicide prevention helplines are available. There are suicide prevention services are available in our status. That definitely will reach some people who are in distress. So active use of social media, Facebook, WhatsApp, Twitter, and some other forums, definitely it helps to reach larger population who are at white collar job or who are able to access the internet and other services. and encouraging responsible coverage of suicide. So this responsible coverage, Lakshmi would have talked about more in detail, but I mentioned in this can prevent, actually, this can reduce the contagious effect of the suicide. And as Madam pointed out, the reducing access to lethal means. So Madam has pointed out two interventions that happened in Tamil Nadu, and especially one particular intervention among the student population, especially the hostlers. The institute from the northeast stopped keeping the ceiling fans in the hostel rooms to avoid hanging as a method of suicide. So, reducing the access of lethal means mostly on a cultural specific interventions, understanding the cultural specific methods, cultural specific prevention. So these are some activities that we can plan in the universal level prevention. Since the participants also come from a diverse background, definitely they're going to see a lot of people who are in distress, or definitely they're going to work in a positive mental health program. Yes? Anything now? Okay, shall I continue?
Please go ahead, Bharat.
Yes, yes. So, as the various professionals are there, definitely they can take this series of program, universal programs, whenever they are taking it, and they can include a suicide prevention component in it. And if they provide some small information in the forum, definitely it will help a lot of people, and definitely they'll get back to their resources. And later, talking about the selective prevention and screening program for to identify and assess at-risk population group. For example, if suicide is very predominant in one particular institute or a particular age group of people, if you go with some screening model to understand whether they have any distress to identify, later, based on the screening, we can intervene with the individuals. So this screening program can also have a component of a knowledge enhancing, like the awareness program followed by a screening survey. So that could help to understand how many people have a distress, whether we can help in the next level. And this gatekeeper training is seems to be a gold standard program in preventing suicide in community level, because it works with it works from the lay counselors to professionals. So whenever we deliver this gatekeeper training program for all set of people, so since last 8 years, Nimman Center for Wellbeing is conducting gatekeeper training program. So we conducted training programs for the college students, volunteers from the colleges, faculties, and IT people, and lay volunteers, and volunteers who like to work with a suicide in suicide area. So we conducted this program for all these people. So after this program, their skill in identifying people who are in distress, who are contemplating suicide is increasing, and it helps in referring those people to the appropriate services. So this gatekeeper training programs for a selective population or a general population definitely helps in identification and referral sources, and support services for the people who are having an attempt. So these support services, if you are planned in the institutional level or in the community level, definitely it will prevent in the second subsequent attempt of suicide. And later we can talk about some hotlines or a crisis center. So whenever people identify some people who are contemplating suicide, definitely they need some sort of resources where they can refer. So these hotline services, almost in India, we have a lot of nearly 16 to 17 hotline numbers. We're getting all languages, I hope. So you can just browse in your mobile suicide prevention services nearby me. So definitely you will get some number which can act as a resource center to get resource where they can go for a treatment. At least they will get a counseling over the phone. So whenever somebody is contemplating suicide, directly you can do one thing. You can just Google in your phone and you can check where is the center is available, what is the hotline number is available, which is the nearest crisis center. So definitely you'll get some information from that, and you can give it to your friend or to talk to them so that they'll get some support from their professional. As well as mobilizing the community and making use of the community. For example, in South India, we have a lot of fans club and other community-based organization. Basically, the religious-based organization, they're ready to work on cause. So if you identify some people, if somebody is contemplating suicide, please check with them whether they can help, they can render some services. So most of the suicide ideation, people who are attempting suicide, the reason for suicide could be psychosocial in nature. So if you are identify that psychosocial problem, if you are ready to work on that, definitely we can prevent the subsequent suicide ideation and subsequent attempts. If, for example, if the person who has some difficulty in getting employment or getting some benefit from the government, if he is attempting suicide for that, if you identify this is the reason, if you link with some resource where he can get the services in future, definitely they can rely on that particular tertiary care support or secondary support whenever there is some crisis. So if you identify some community level support, make sure that your friend or client who's connected with that society association, so that in future if they have some sort of a crisis, definitely they will rely on those support. So these some activities that we can plan in the selective level prevention. Later I move to the indicative prevention. This is a very important thing. This we deal with the individual people who are at risk. So whenever we identify, as Madam said, that mental disorder, people with mental disorder have a high chance of suicide prevention, as well as the substance use people who has a high chance of suicide attempt, or else people who are getting lost in their business during this COVID time. Definitely there is a potential risk of suicide. So if you identify some people, definitely please render your genuine care to them. Ask them, how are you feeling? Can I help you in some way? Are you okay? If you ask some sort of this supportive statements, definitely they like to talk to you, and further they can express their hopelessness feeling over the situation. Definitely from there you can pick it up what the risk they have, and later you can refer to the services. And family support services. If somebody is attempted suicide, or somebody is some suicide death happened in the family, definitely we have to look into the family and the friends who are very close to the deceased person. So we can go and check with them how is their mental status. If they are having more distress, then you can talk to them and you can give a supportive services to them. Definitely it will help in developing an ideation, or else it can prevent an attempt as well. So, and skill building support group programs. This is especially for the people who are attempted suicide and they are in treatment or they are in the community. If you identify some people, please bring them in a group, and if they are shared among the people, definitely they will get some hope from the people how they can go about it. Since this is a professional group, social workers, psychologists, all are there. So if you happen to see any client with a suicidal ideation, definitely this case management approach, definitely it will help. You can identify the potential support, potential resources available in the community to make sure that this particular client or friend who is getting support all the time whenever he is in crisis, you can plan your case management approach. And subsequent community support and psychosocial follow-up, as Madam mentioned, sending a message or just checking in WhatsApp, how are you doing? Are you okay? You need any help? Those things definitely it helps in the long run. So this particular slide, I just wanted to introduce to you how you can make a risk assessment in a simple statement. So just you can ask these 4 questions to understand whether this person is having a risk of mild to high level risk. So you can start with the see, whenever people develop any suicidal ideation or a hopelessness thought, definitely they might have some psychological or a physical pain, so which may cause the hopelessness. I'll give you an example. For example, a student who had a failure in their exam. Uh, because of that, he's feeling that I can't be a successful person. Definitely, I can't clear the exam. If you have that hopelessness, definitely there is a potential chance that he has a mild level of suicidal risk. So if he has this failure, but he is hopeless, if you think that I have some people, my friends or my teachers, who can help me in this situation. If we have this connectedness, my family is there to help me, my friend is there to help me. Definitely, the risk of suicide will be staying mild. If he doesn't have the connectedness, definitely it may increase to the moderate level risk. He might not talk to anyone. He will tend to withdraw from himself from a social gathering or a family. Definitely, the level of risk might increase to moderate level. So, though he has a good connectedness, but if he has a previous attempt or some risk factors like he is a substance user or the family has a past history of a suicide attempt, completed suicide, definitely the chance is high. If you think that the connectedness is less and hopelessness is not there and previous attempt is there, you have to link these people with the mental health professionals so that they'll get a support from the people. So the same thing, I just put it in the infographic chat so that you can understand how we can work.
Sorry to interrupt, Bharat.
Yes, sir.
Can you slowly wind up so that we can
Yes.
also.
Yes,
Yeah,
sir.
yeah.
One more slide. Yeah. So whenever there is a person have any distress, you can show your genuine care. Then slowly they will tend to discuss with you about their difficulties. Then you can discuss with them and you can identify their interpersonal and intrapersonal strengths, which are the supports they have, how they overcome so far. So make use of those support, then try to improve the connectedness with the society system. For example, linking them with the hospital, linking them with the professional, linking them with the community people, family members, so that next time they can, if there is any crisis, they will rely on the support. In the long run, this community support will help him to overcome his crisis. So you should be a good listener whenever you are doing any intervention, and you should be non-judgmental when you are offering any support. These are the things we might know, and so whenever there is any person or contemplating suicide, please make sure that you are creating a plan, the crisis plan, which makes them stay safe. So either it can be a contract, it can be a touch with a family member or a relative, or it can be providing a contact number whenever there is a crisis. So those things you can try so that they will connect with somebody who's in the society. And as a part of a crisis planning, you can ask your friend or a client to distract themselves with a suicidal thought by engaging in some of these activities like watching TV, painting, playing with friends, or talking to friends, and so on and so forth. So, if they are contemplating suicide, or if you feel that they are definitely may this situation occur again, please provide alternative phone numbers like mental health professional phone numbers for suicide prevention helpline, and get the alternative phone number to reach your friend or client. So these are the things that you can take steps to prevent suicide when people are contemplating suicide. At last, post-vention intervention. This is a very important aspect that we need to look as a professional. Whenever there is any suicide happen in community, in institute, anywhere, please always try to identify who are the closest people who may be affected because of this aftermath of this suicide. So check with them and try to enhance your supportive service to this vulnerable group. It helps in preventing a suicide, as well as it can prevent from the suicide developing a suicide ideation, as well as it helps in improving their functionality as soon as possible. So you try to offer your support and timely. That is very, very important post intervention, the post-vention intervention. Thank you. So, yes, sir.
Thanks, Bharat. Thanks, Bharat.
Yes.
Shall we move on quickly to Lakshmi? Should we be talking about the role of media and what are the responsibilities of role of media in amplifying or intentionally and news? So I request Lakshmi to Lakshmi.
Yes, sir. Hi, good evening, everyone. So it's an honor to be presented in such an esteemed forum. So I'll just start sharing the screen and we can start it off now itself. Is everyone able to see the screen?
Yes, yeah. Please go ahead.
Okay. Yes. Okay, so today I'll be talking about suicide prevention and the role of media in the whole process. So since we have been having this discussion for the past, like yesterday and today, you'll find that some of the contents may be repeating, but I'm sure that it will be worth repeating, hopefully. So initially, I'll just talk about how COVID has brought in some changes, if not many, in the whole concept of suicide. And then we'll move on to what is the impact that media reporting has on suicide and obviously on suicide prevention, and what are the things that maybe we can be mindful of. So COVID-19, the pandemic, as we all know, it was declared a pandemic on 11th March 2020. And after that, it has been considered as a major public health concern. So apart from the obvious things, like how Anisa was saying earlier, apart from the obvious implication that it has also brought about a lot of direct and indirect impacts that any disaster of this magnitude would bring in, especially in the mental health area. So what could be the possible reasons? You'll find that the worry about being infected, being tested positive, social isolation, fear of losing their job, current unavailability of alcohol, or not able to reach home due to the lockdown. These are the possible reasons that one could decide of ending their life, at least from what we have seen in the past couple of months. And who are at risk with a pandemic at hand? Everyone is at risk. But at the same time, there are certain groups which are more vulnerable, and there are also certain factors which are considered to be risk factors. So some of them includes the mental health issues, the domestic violence, people who are abused, and the disruption of livelihood to individuals who have that happened, and migration and economic difficulties, and youth and elderly are considered to be some of the vulnerable groups when it comes to suicide. And apart from the other risk factors in general, COVID-19 in itself has brought economic stress, social isolation, decreased access to community and religious support, barriers in accessing mental health services. And in this context, the current topic that I would be talking about, the media portrayal of the disease. So with the number increasing day by day and how the media decides to portray the disease in itself can be anxiety provoking. So how is it that media has an impact when it comes to suicide reporting and the subsequent suicide rate? So I have two sort of case vignettes here. So I have sort of underlined certain statements. So these are news reports that you would find every day. It's nothing new that or something new that you would find in here. So the heading talks about how the couple was found dead in the hotel room, and the time is given, and how they knew each other since school and wanted to get married, but their families were opposed to the idea, and how they committed suicide in a hotel room in Haridwar, and the name of the individuals and where they are from, and how they were found. They were found in a pool of blood on the floor. And also this is another report. These are just two reports. So you'll find, like how Nisa was saying yesterday, we were able to find around 1,900 something reports about suicide. So here, unable to bear the mother's treatment cost, man kills self with kin. So how it was done, where it was done, and the entire details are mentioned here. So this is something that we see every day, but why is it significant to us? So research suggests that suicidal behavior can be contagious, as in there is a cause-effect relationship between the quantity of the reporting that is done on completed suicide and the subsequent suicide rate. So there are two concepts that are of significance here. One is the Werther effect and second is the Papageno effect. Werther effect is the negative impact of suicide reporting that is done by the media. So history says that in 1774, when Goethe, the novelist, wrote a novel about young Werther. The Sorrows of Young Werther is the name of the novel, where the hero could not get the woman that he loved and decides to end his life, where he shoots himself. So after the release of the novel, there were a lot of copycat suicides, and it led to a lot of European countries banning the book. And that's how the whole concept came up as to how media reports or how the media portrays suicide can have an impact on the people deciding to do suicide. Then Papageno effect is a term that has come considerably late, where around in 2010, where it talks about the importance of media when it comes to suicide prevention, as in what is the positive impact that media can have. Again, this is a opera that was written by Mozart called The Magic Flute, where Papageno is the hero, where similar circumstances, but he decides not to do anything considering the social support that he has. So these are the two concepts which are significant to suicide contagion, and researchers suggest that it's more likely when the method is specified. So I want you to connect all the points that we're discussing currently to the reports that we saw earlier. So suicide contagion is more likely when the method is specified, the story is repeated, it's dramatic and prominent, and especially so in case of celebrity suicide, and where the reader can relate to the report when in terms of age, sex, or nationality. But it is the good thing is that research again suggests that it's possible to reduce the risk by implementing guidelines. So we say that, okay, there is a causal relationship. What are the criteria that we consider in order to say that there is a causal relationship? So one is the strength of the association, which is basically how statistically significant it is, whether there's a consistency into it. Temporality as in the media report should come first and then the increase in suicide rates. Specificity, is there a definite connection as to the people who have died by suicide have been exposed to these media reports, and also coherence in the sense that it should be in keeping with all the things that we already know about suicide attempts, suicide ideation, everything related to suicide. So why is it that media has such an impact on the individuals, or why is it that we should be mindful of what we report and how we report? So there is theoretical background to it. So social learning theory, so these are three theories that are used to explain the phenomenon. So according to social learning theory, it suggests that there is a group of vulnerable people who are suicidal, and when the report sort of glorifies or puts suicide as the only and the best way to come out of a situation, the individuals may resort to dying by suicide. So that's what social learning theory suggests. Differential identification theory suggests that no matter what it is reported, unless and until the reader do not relate to it, it's not going to make much of a difference. Which means that if I relate to the report in any way possible, like I said earlier, whether it's the age, whether it's the gender, if I'm able to relate to it, then there are chances that I as a person may die by suicide seeing the report. So here also there's this concept of vertical identification, which is significant in terms of celebrity suicide, where we tend to look up to people who we consider are better than us. So that is where the whole concept of how celebrity deaths are reported is significant. Symbolic interactionism talks about how it's the mood of the individual. If there is a group of people who are depressed or who are feeling low and more impulsive, then the chances of them getting influenced by these reports are more. So there are guidelines. So like how we were talking earlier, there are a lot of guidelines that is being given by different organizations. For the lack of time, I have just stuck on to the one that is mentioned by WHO in association with International Association of Suicide Prevention. You'll find that these guidelines are given by Indian Psychiatric Society, Samaritans, SNEHA, so most of the organizations that are working in the field of suicide prevention. You'll also find that recently, like September last year, even the Press Council of India had came up with this concept of reports on suicide should not be sensationalized. So here, I've just mentioned the do's and the don'ts. So do's, when it comes to the guidelines, this is the 2017 one. Initially, it was a 2008, which was ratified in 2017. So the report should be providing accurate information about where to seek help. And it should also be using this platform as a means to educate the public about the facts of suicide prevention without spreading myths. And also reporting suicides as to how to cope with life stressors or suicidal thoughts, success stories basically, who had all the reasons to maybe end their life but did not because they accessed whatever resources that they could or they sought help. So any success story would do. And especially when it comes to reporting celebrity suicide, media has to be very mindful. And also interviewing the bereaved family or friends, that is also somewhere there that they have to maintain caution. And it's also important that we take into consideration the media professionals who are reporting these stories. So it becomes a responsibility of the supervisors to make sure that the juniors are taken care of, and their mental health is also something that is to be considered. Don'ts: never place the stories about suicide prominently in the first page with a lot of paragraphs and unduly repeating such stories. Also, it is recommended to refrain from language which sensationalizes or normalizes suicide, or it presents itself as a constructive solution to the problems that the person had. Also, not explicitly describe the method used. So in some news reports, you'll find that the method is described in detail with all the gore things mentioned, which is again not recommended. Also, don't provide details about the site or the location so that it doesn't get the reputation of being a suicide point. And also never to use sensational headlines. So never to use the word suicide in the headline or anything that sensationalizes, and never to use the photographs or video footage or social media links. So again, you'll find that in the two reports that I have shown, most of it, maybe not all of it, but at least most of it were not being adhered to. So there are a lot of studies that are being done. Again, I'll just talk about some of it that we have found. So guidelines are again something that cannot be enforced per se. So this is something that is recommended. So there are studies, these are Indian studies, which wanted to see whether the media actually adhere to these guidelines. So Jain et al., this study was done in Jaipur in 2016, where he looked at 10 newspapers, and what they found was, it was from a period of October to December 2016, and they found that most of the newspaper reports did not sensationalize the suicide process, but at the same time, not much educational material were given in these newspaper reports. So that's something that came out predominantly as the finding. Armstrong et al. In 2018, this was done in Chennai, where it was from June to December 2018, and they looked at 9 newspapers. And again, what they found was when it comes to reporting, some newspapers did make sure that it is not sensationalizing, but at the same time, when it comes to dispelling the myths or looking at what are the positive aspects of success stories, it was not much done. So this was one study again which spoke about the significance of media in suicide prevention and how the media professionals and the researchers should work hand in hand. And Hashi et al., this was in 2016, where they looked at celebrity suicide. So since there was no celebrity suicide at that point of time in India, what they did was they looked at Robin Williams, the American actor, and they did a study. They looked at 3 newspapers, 3 months prior to the death, the celebrity death, and 3 months after. And they found that after the celebrity suicide, there was a sudden spike in the number of reports that were being done in the print media. And Chandra et al., this was done in Bangalore. So they looked at 3 vernacular newspapers and 3 English newspapers, and they wanted to check how much. So especially they wanted to look at what are the mental health aspects that they've covered. So apart from the educational materials not being there, mental illness or mental health issues which contribute a great deal to the amount of suicide attempts or completed suicide. How much is that being reflected in the reports is something they wanted to check, and they found that around only 4% reported mental illness or mental health issues as a cause. So we were looking at pathogen effect earlier. So these are some of the studies which looked at how media can have a positive impact. So the Michel et al. 2000 study that was done in Switzerland. So what they did was the Switzerland media editors, they decided that they wanted to check whether there can be a change in the way they report, and they collaborated with the researchers and trainings were done, and they found that there was a significant reduction in the way suicide news were sensationalized, and also there was a significant reduction in the number of even suicides being reported. So the Ligman and Sonic etc. for that study was done in Toronto and Vienna, where they restricted the number of suicides being reported in the subway, which again they found. So subway was a place where it was like a suicide spot, and they found that with this restriction that they placed on reporting subway suicides, there was a reduction in the subsequent suicide rates. So Martin et al., this was in 1997, where it was after the death of celebrity Kurt Cobain. Usually celebrity suicides, it leads to more rate in suicide. But here, the media was not very appreciative of the way he decided to do it and the why and everything. And then it resulted in a lot of suicide preventive measures being coming in. So that is also considered to be one of the Papageno effect, the suicide prevention measures that media can have. And the other two are how training can have a positive impact when it comes to reporting, and also the way media choose to see suicide as. So Gurraz et al., this was again done in MIMHANS. They were looking at collaborative efforts for suicide prevention, and they were working with different stakeholders. One of them were media journalists. So they came up with different guidelines, and they found that after the training, there was a change in the way they were reporting. A responsible way is what was found. Ramdas et al., this was done in Kerala. So what they did was they adopted some of the things from the Indian Psychiatric Society guidelines, and they trained the professionals, the media professionals, and they looked at how the media professionals report suicide has changed over the years. Before the training, immediately after the training, 1 year after the training, and 4 years after the training. So that is something they did, and they found significant improvement. So So here it becomes very evident that how media, when it chooses to, and when researchers and media professionals sort of collaborate, media can be a very positive tool and not a tool that is used much when it comes to suicide prevention. So considering that media reports, this is again from WHO, the guidelines that they've mentioned. So considering that media reports about suicide can lead to the additional suicide behaviors, which include suicide and attempts, it is imperative that we consider and we take media into our scenario and make sure that we are on the same page, so that it can be used as a method of suicide prevention. And also how it also focuses on how media professionals can exercise caution when it comes to reporting on suicide, so that, yes, the public needs to know and they have the right to know, but not at the risk of causing harm. So this again can be accomplished only when the researchers and mental health professionals and media professionals all work together, so that we can stop being on parallel lines and go to the same place in the same way maybe. So yes, that is it. Thank you.
Thank you, Lakshmi.
Yes.
Shall we move on for some of the questions raised by the audience? I'll read out some of the questions where we can answer some of them. And these questions specifically for Priya. One was difference between self-harm and suicide, the terminology you use. Can you just elaborate on that?
Yes. So basically, self-harm refers to any action that will cause physical harm to yourself. The difference between self-harm and attempted suicide is, in attempted suicide, you physically harm yourself with the aim of dying. All right. So there is a difference. So sometimes you're angry, you're frustrated, you go bang your head against the wall, you put your fist against the wall. That's not an attempted suicide, because the intent to die is not there. there is an attempted suicide, there is actually an intent to die. All right. Now, sometimes there can be a lot of ambivalence. You are not sure whether you want to die or not. You're harming yourself. The WHO goes by the term in such cases where even there is an ambivalence and there's a possibility of dying to consider it as a suicide attempt. So a lot of times people use an umbrella term of deliberate self-harm when they're not really sure about the intentionality, but the difference is basically the intentionality.
Okay. Can you just talk a bit on family history and personal previous attempt as a risk factor for
Yes, see, a previous attempt of either deliberate self-harm or a previous attempt of suicide is a risk factor for a repeat suicide attempt, is a risk factor of dying due to suicide. So in fact, it's one of the best screening aspects, irrespective of whether you have a psychiatric disorder or not. A previous history is something that you have to be looked into. Family history has also been noted, not just in terms of, okay, a family history of psychiatric disorder. Similarly, you will have a family history. Family history, independently of death due to suicide, again seems to predict death due to suicide, whether it is because of certain factors like how Lakshmi is described in terms of contagion or not. We are not sure. It sometimes you see the death even after many years, but that's also a risk history of a suicide attempt or deliberate self-harm.
One more question, I think, is related to your topic, like suicide and culture. How important is culture?
Culture, see, we'll have to first look at what is culture. Culture really basically includes all the aspects in that area: the food they eat, the religion they practice. So there has been literature which has really looked at, is religion protective? You do see definitely so-called lesser deaths due to suicide, but it could also be the more religious of particular places, there may be lesser reporting because they're concerned about the ostracism. A lot of religious rituals will not be allowed really if you report. So culture, to a certain extent, does influence reporting of the suicidal ideation, the expression of the suicidal ideation. If you really look at what Emil Durkheim and all have reported, the change in the culture, sudden changes where you're looking at a loss of previous rituals, newer rituals being introduced in, they can also really predispose from a cultural aspect in the prevalence of suicidal attempts.
Okay, thanks, Priya. This question for, I think it's for Bharat. It's about how to have a healthy environment in school, suicide prevention, starting from the teachers and school authorities to curriculum. That's what the question is.
So, the healthy environment in school or any educational institutes, where they should get a space to discuss about their concerns with the institution, faculties, or friends. If the student has some distress, if they're able to talk to the teacher without he or she is being judged, they have this problem. That's a good environment, we can say. How we can achieve this? By educating the institute or training the staff, either teaching staff or non-teaching staff involved in the institute, as well as volunteers who are ready to render or offer their time for helping others. If you are able to make them understood this phenomena, like mental health issues or any stress-related issues, if you are make them sensible to look up to this issue, if they are able to provide the services in the campus, definitely that can allow people to access these issues, mental health issues.
Okay, thanks. This is not a media-related question, but I know Lakshmi had actually some work with the domestic violence and related aspect as well. So, how the domestic violence will contribute for the women to think of suicide or suicide.
Okay. So I think not just specific to domestic violence, which again researchers suggest that the level of, or let's say the number of domestic violence and child abuse has all increased during the time of COVID. Other than that also, domestic violence put a person, regardless of the gender, puts a person in a position where they feel helpless, hopeless, and which are things that would make the person feel like life is not worth living. So the whole point of a person deciding to end their life, from what we have seen, is basically the lack of hope, the faith that things could get better, or what I'm feeling right now is something that would be going on forever. So from like little knowledge that I have about domestic violence and suicide, I would say that the person, especially when they are not having anyone to talk about that, or this is when it comes to domestic violence, we tend to think of it as something that happens inside your home. People don't usually talk about it. If, let's say, I'm going through domestic violence, I do not want to share it with other people, thinking that whether there'll be stigma, what will people think. So that again put me in a position where I'm not talking or sharing it with anyone. So if we are to consider the preventive measures that we looked at in suicide, that is the first thing that we talk about. Like, you are supposed to talk to someone and see what are the alternatives that are available. But unless and until you are not in a position to do that, I don't think it would work out. So yeah, I don't know whether I answered the question properly, but yeah, this is.
Do you want to add on to that from your experience from your center? Is there anything else you want to add? Domestic violence, yes, or violence
definitely
related?
We have definitely seen actually that women with domestic violence are definitely at higher risks. We've seen that's quite a significant proportion of our population. A lot of times the suicide paradoxically worked in the family, her family of origin becoming sensitive to how much she has suffered. And a lot of times what has happened is we have gone ahead, we have independently followed up. What we need to realize is usually when they attempt because they've exhausted all options. That's what we have seen in such scenarios. So follow-up care really helps. Like in our situation, we have had 3-4 cases wherein when we realized that there was domestic violence, probably the husband himself had a psychiatric illness, because of which we contacted the lady's family of origin 2-3 times through a funded project. We actually gave her some money so that she could come register, because we are a private setup. I think in 2-3 cases we've been able to successfully call the husband at least to have a discussion in terms of depression, how to handle it. But I was seeing the chat. They have said you can't. How do you really handle it? Handling has to be with a lot of tact. One is we ensure a mechanism of follow-up wherein everyone is comfortable, that at least I'm describing from what our setup is, we keep contacting them periodically. And the husband is well aware, because you're looking at if women who have to escape will be able to escape. A lot of them are not financially in the position where they are able to escape. That's point number 1. All right. In point number 2, once they become comfortable with the idea of follow-up, opening up the idea of, why don't you consider counseling? It may be helpful. So it involves a lot of tact. You can't directly go in and say, look, you're hitting her, that's why this is happening. A lot of times the scenarios are such, the person who's hitting her is the only financial and economic support really. So we'll have to handle it with a lot of tact. What is helpful is if you can establish some kind of a follow-up mechanism wherein if there's a particular person is handling, like we had the same nurse who was handling, so she knew all of them very well. So that really helped. But yes, you should follow them up. We've been able to have people who have been following up quite regularly with all these issues, and we've actually had some, I wouldn't say happily ever ending, but some stories where we've had very pleasant surprises in the way they've turned up.
Can you just talk about the data from NCRP? Someone is asking about data from Assam. Do you have anything on that, Priya?
I actually have the data. I'll just show it to you. 1 minute. Just share the screen to the NCRB. I will show you the data. 1 minute. Huh? This is the NCRB report. See, this is freely available and it's a really wonderful document to go through. 1 minute. Yeah. Here it is. I've highlighted it. So if you look at it profession-wise, these are absolute numbers. If you look at Assam is highlighted. So homemakers, that is housewives, are around 378. Yes, these are 378. And if you look at it in male salary professionals, you have 178. Now, people were concerned about students. How do students really look like? I'll just go down. I have that here. If you look at students are again around 357. But someone asked about every day you see reports. See, you will see reports every day about students because this is a young population. This is a population where you really don't expect death. Suicide is one of the most common reasons for death in this productive population. Other groups, if you look at it, again, see unemployed is a very high number in Assam. If you look at it, absolute numbers are 791. Same rate in terms of, I think, the farming sector is around 107. So the Assam findings are very, very similar to the findings that you would see in the rest of the country.
Thanks, Priya. The last, but not the least, I think it's a very genuine concern from an audience. The question is, the most of this helpline which we're talking about works from 9 to 5. And Bharat, can you discuss about the current government plans or the new scheme where do you have any 24/7 or helpline available at the moment, especially in Assamese or the North Eastern language?
Yes. So as the participant mentioned, majority of the helplines are working 8 to 9 or based on their comfortability time, based on the volunteers involved in it.
Bharat, please unmute yourself.
Yeah. So the government, as many people said, like many of the helpline numbers are working from the time 8 to night 10 o'clock or something. But there is a government program. Kiran recently implemented that 24/7 program is there. It takes some time for us to modulate 24/7 helpline. However, this one particular platform also where they can get a consultation for their suicidal thoughts as well. So they can look into this. Other than that, they can check with other crisis center nearby in the district hospital or some private hospitals where they're offering crisis center. Those things they can check.
Okay. I think the link has been shared in the chat box. So
yes.
So you can go through that. Thank you all. We have addressed one of both to bully for many companies.
Thank you very much, Dr. Anish Charier, for making the panel discussion very lively and interactive. And I'd like to extend my thanks to Dr. Priya Sridharan, Mr. Bharat, and Ms. Lakshmi for being a wonderful speaker for the panel today and for your fascinating presentations and discussions. I hope some new learning has happened, and I'm sure that this dialogue has generated a meaningful takeaway for all our audiences today. Thank you all once again. And now I would like to hand over to Ms. Rituparna for the concluding remarks and a vote of thanks.
Thank you, ma'am. Thank you, ma'am. I, Rituparna sir, take the privilege and great honor to propose the vote of thanks to all who have helped us in making this webinar such a resounding. With the COVID-19 pandemic still accelerating and impacting people in multiple ways, hitting lives and livelihood, the pandemic is causing fear, anxiety, depression, and stress among people. Early identification of mental health condition, recognition of suicidal behaviors, and appropriate management through a multi-sectoral approach is important. Doing assessment and reaching out to the community people as well as the individual during this pandemic situation is the need of the hour. Therefore, media plays an important role in suicide prevention. Younger people seem to be the most vulnerable to the influence of the media. Looking into the positive aspect, media can be used to make the people aware, and it provides a platform to reach out for help. Suicide prevention strategies are most needed today. Together, we must work towards promoting mental health and preventing suicide. Today's webinar focused on this year, that is working together to prevent suicide. Yes, indeed, we must work together to save lives. I, on behalf of the Department of Psychiatric Social Work, like to extend a very hearty vote of thanks. First and foremost, I thank Dr. S.K. Deori, Director, LGBRIMH, Tezpur, for your encouragement. I would like to thank Dr. Jyoti Hajarika, Medical Superintendent, LGBRIMH, for supporting us. I wish to express my gratitude to Dr. Sonia P. Deori, HOD, Department of Psychiatric Social Work, and the organizing president for your moral support and guidance in organizing today's webinar. I express my heartfelt gratitude towards all the speakers in the panel, Dr. Anish Cherian, Dr. Priya Sridharan, Mr. Bharat R, and Ms. Lakshmi Vimala, who blessed us with your presence and took out time from your busy schedule. Thank you for sharing your valuable contributions in today's topic from your field of expertise. I hope the discussion today has helped each and every one of us to gain more insight on suicide prevention during this ongoing pandemic situation, and how important is the role of media. I would like to extend a special thanks to Dr. Arif Ali, Assistant Professor, Department of Psychiatric Social Work, LGBRIMH, and convener of the program, for his enthusiasm in organizing the webinar. Thank you for your inspiration. I wish to extend my gratitude to Mrs. Bulinag Daimari, Psychiatric Social Worker, LGBRIMH, and co-convener of the program, for her prompt response and guidance throughout the program. I wish to express my heartfelt gratitude to the advisory committee members of LGBRIMH, Dr. Arunjyoti Borwa, Professor and Head of the Department of Psychiatric Nursing, Dr. Shobna H., Associate Professor, Department of Psychiatric Social Work, Dr. Priya Saxena, Associate Professor, Department of Clinical Psychology, Dr. Vijay Gogoi, Associate Professor, Department of Psychiatry, Dr. Noor Nahar Ahmed, Assistant Professor, Department of Psychiatric Nursing, Dr. Indrajit Banerjee, Assistant Professor, Department of Psychiatric Social Work, Dr. Subhashis Nath, Assistant Professor, Department of Psychiatry, Dr. Siddheshwara B.L., Assistant Professor, Department of Psychiatry, Dr. J.K. Das, Assistant Professor, Department of Pathology and Microbiology, Dr. J.K. Fukar, Assistant Professor, Department of Biochemistry, Dr. Shuhasini, and Dr. Sharad, Senior Resident. Thank you to Ms. Priyanka Saikia for coordinating with the media partners. Thank you, Tezpur Bus, for being our media partner. I would like to thank all the coordinators, Ms. Marinella H., Psychiatric Social Worker, Department of Psychiatric Social Work, Mr. Nilesh Maruti Gujjar, and Mr. Abhijit Singh, PhD Scholar, Department of Psychiatric Social Work, Ms. Rini Gogoi, Ms. Adipriya, and Mr. Stephen, MPhil Trainees, Department of Psychiatric Social Work, who have worked earnestly and provided continuous help to make the program successful. I extend my gratitude to Dr. Bhupender Singh, Assistant Professor, Institute of Mental Health, Rohtak, for your guidance. I wish to thank Mr. Upender Singh, Lecturer, RMN Hospital, New Delhi, for the graphics designing of the brochure and the technical support. Thank you, Mr. Vikas, PhD Scholar, RINPAS, for helping us in live streaming of the session in YouTube and Facebook. Once again, Thank you to Dr. Bijay Gogoi, Associate Professor of Department of Psychiatry, LGBRIMH, and Digital Academy in charge for providing us the digital platform to conduct the program. Thank you, Mr. Utpal Bora, Mr. Kishore, and Mr. Nirmal Basumatari. Us all the support. Last but not the least, I would like to thank all the participants who have turned up in such great numbers. Thank you for your active participation in the discussion, whom this webinar has enlightened with new perspective on suicide prevention during COVID-19. Once again, I thank you all for your cooperation. Thank you. And for today's session, there total 800 participants have registered, out of which 250 participants have joined through Google Meet platform, and rest of them have access through YouTube and Facebook Live. And, there is an announcement. Feedback link has been given in the chat box. Kindly fill it up and submit to us so that your valuable contributions will help us incorporate in the future program. Thank you.